Hey guys, it's Oscar here, and I hope you guys are having an amazing day today. And this is my first live stream here on YouTube on this channel with Gastroenterology Simplified. Let me go ahead and introduce myself. My name is Oscar. I'm a board certified physician assistant. I've been practicing for about 13 years now when it comes to gastroenterology, and I have been practicing as a PA for the past 15 years now. And I created this channel because I wanted to help people understand different medical diagnoses in simple terms, just very basic terms. And gastroenterology is my passion, and is something that I've been dealing with myself when it comes to the GI system. And that's why I created this channel. That's why I went into this specialty, gastroenterology, and I love it. So on this live stream, I want to be here for about, let's say, 15 to 20 minutes today, since it's my very first live stream. And let's see if it is working. Let me see something here. The volume. And I hope you guys can hear me. Um, and I want people to, let's go ahead and give people some time to log in so we can go ahead and answer some questions if anyone has questions. And recently I posted a video about GERD. GERD is one of the most common diagnoses that I see on the daily basis in the clinic. Let's go ahead and turn this off. Anyways, yeah, so it's one of the most common diagnoses that I see on the daily basis at work. And let's go ahead and talk about GERD. We'll give some individuals some time to log in. Let me go ahead and get a few things here. And let's go ahead and also use this as well. But so I have some notes here in case anyone wants to have any questions. And yeah, I'll go ahead and let people log in and ask questions if they have any questions. I don't think this camera is the best, but let's go ahead and wait for individuals. So my most recent video was about GERD. Next video, which is coming up on Monday, is going to be about gastritis. And what I do, I follow pretty much the book. I follow the book and I try to make it very simple and easy to understand for individuals to understand what is, for example, gastritis, GERD, choledocholectasis, what is a peg tube, gallstones, and so on. So that's what I'm trying to do here. Let me fix the audio because I don't think the audio is the best. So I guess we got to go here. System and audio. So right now we have session slides on. Okay, sorry about this. And okay. Okay. But anyways, let's give it, a few more minutes so people can log in and ask questions if they have any questions. Once again, I'm Oscar and I'm a board certified physician assistant and I practice gastroenterology. I open this channel, Gastroenterology Simplified, to make gastroenterology or topics when it comes to gastroenterology simple to understand, very, very basic understanding for an individual, for any given average individual. And I make it like I'm talking to, one of my, parents and or brother or sister, or one of my friends that has no idea when it comes to medicine. So that's the reason I created this channel. A lot of people at work or a lot of patients, they ask me, and or when I explain to them gastroenterology or the diagnosis in simple terms, they seem to be very satisfied, and that's something that I want to reach the masses when it comes to this. Okay. And yes, please ask any questions when it go. Today, we're going to be talking about GERD or gastroesophageal reflux disease. And GERD is one of the most common diagnoses that I see on the daily basis. And sadly, 80-90% of the symptoms is because our lifestyle. Um, Eating, spicy foods, greasy foods, processed foods, caffeinated drinks, and or overdoing the caffeinated drinks, and that's what causes GERD, usually, or gastroesophageal reflux disease. And a lot of people ask, "What is GERD? What is it?" Well, GERD is pretty much you only feel or you have the symptoms when the acidity goes into your esophagus. When the acidity comes up to your esophagus, and that's why you feel the symptoms. And the reason is because your lower esophageal sphincter or LES, the sphincter is weak. And when the sphincter is weak, it lets the acidity go up. It goes up into your esophagus, and that's why you have the symptoms of GERD. And that's why you have the symptoms. And how do we fix it? Or how can we prevent it? Well, my number one thing is smaller meals more often. That's first thing that I recommend. Number two, lifestyle changes. You have to avoid caffeinated drinks, greasy food, fatty foods, salty foods, red sauces, um, and dark chocolate. But the thing is that if you avoid them for, let's say, 2 weeks, 3 weeks, and then maintain a healthy lifestyle, make sure you ambulate a lot or walk a lot, get your 10,000 steps per day. Your last meal should be around 6 p.m. Make sure that you let your body do its work. So you want the stomach, we have the stomach, right? You want the stomach to empty, which empties every 3 hours or so. So you want the stomach to empty every 3 hours, and then you don't let that acidity come up. So, for example, a lot of us, we work from 8 to 5, 9 to 5, and we come home and we just want to relax, eat and relax. But if we eat and relax, or if we eat and just go to bed right away, you're going to have that food sitting in your stomach. It's going to be sitting there, and the acidity, because the acid is what breaks down the food, right? It breaks it down. Your stomach goes like this, and then the acidity destroys the food, and that's when you're able to digest it. When you have the when you have that happening, right? When you're digesting the food, and if you go to bed right away, you're all that acidity is going to come up to your esophagus, and that's why you're going to experience the symptoms of acid reflux. And that's what acid reflux. And in some cases, your doctor or your physician assistant or your nurse practitioner may prescribe a medication called Pepcid or omeprazole, pantoprazole, which is going to help with the symptoms. It's going to help you. And usually they're prescribed for about 2 weeks. And remember, you have to keep in mind that medications are a band-aid. So your job is to change that, your lifestyle. And if you change your lifestyle and you follow the recommendations, and it should help you out tremendously. But that's pretty much what GERD is. We have another 4 minutes left here. And if anyone is logged in and wants to ask any questions when it comes to the topic of the day, which is GERD, I would be more than happy to answer it. Once again, this is my very first live stream here on Gastroenterology Simplified, and I truly appreciate every single individual that has subscribed to the channel. Guys, I'm here to help you understand your stomach diagnosis. Also, pretty soon, I'm going to be launching this. How can I say? I'm going to be launching this program where once every other week or every other week, I'm going to go ahead and accept some appointments where I can go ahead and sit down virtually, sit down to with the individuals and explain their diagnosis in simple terms. Uh, 15, 30-minute appointments, and just have a casual conversation where they can ask and I can go ahead and explain it to them. This is going to be pretty soon. I'm working on the schedule, and I'm going to be offering this service for individuals that want help on understanding their diagnosis, or maybe they don't have the time to ask their doctor because their doctor are always rushing and they just need to see the other patient and so on. So that is a program or a service that I'm going to be launching very soon. And if you're interested, I need you to please subscribe and comment um, stomach help. That's going to be the keyword. Stomach help or my belly help. We can do that as well. And yeah. So in conclusion, let me see if I can offer something else to you guys about GERD to finish up GERD. Just keep in mind that if you leave acid reflux untreated, eventually it's going to cause esophagitis. And what is esophagitis? Esophagitis is inflammation, irritation of the esophagus, which is the food pipe that irritates your your esophagus, and that could be very painful, especially with females. It actually mimics a atypical chest pains. Other complications that you may experience is esophageal strictures, which esophageal strictures is when your esophagus, which is the food pipe, creates a stricture. So food can't go through that easy. And you're going to go ahead and experience like your food is getting stuck in the mid esophagus and it can't go down. So that's another complication of untreated acid reflux. And lastly, Barrett's, Barrett's esophagus, which is a precancerous condition. Barrett's esophagus is something that um, should also be looked at, and it needs a close follow up. Um, One thing that I didn't mention earlier on this live stream is that yes, lifestyle modifications is very important. So what we eat, we are what we eat, but also alcoholic drinks and smoking causes the same issues to your esophagus and stomach. It irritates your esophagus. It irritates your stomach. So you have to keep that in mind. You have to make sure that you avoid all those triggers. That's pretty much. Um, and that's pretty much it for today. I said I was going to be here for about 15 minutes or so, 20 minutes. We only see one person uh, watching the chat, but no questions today. It's completely okay. It's my very first live stream on this channel. And if I'm going to go ahead and try to do this every Thursday or Wednesday around 7 p.m. Eastern time here in the United States. And if you are in other countries, I do speak Spanish and I could answer questions in Spanish as well. All right. Okay, guys, thank you for everything. And I will see you next week on our next topic, which is going to be gastritis. All right. The video should be up by Monday or Wednesday next week. All right. Don't forget to click like, subscribe, and I will see you on the next one. All right. Bye.